Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to Focus on Health. I'm your host, Peggy Mello. Today's guest is Dr. Scott Osur from the Certified Allergy and Asthma Consultants. Welcome to the show, Dr. Osur.
Thank you, Peggy.
Why don't we start by talking about your practice and then we'll go on from there.
Okay, sure. We are a group of allergists. There's 7 physicians in our group, and our main office is in Albany, New York, and we also have offices in Schenectady, Troy, and Clifton Park. And we take care of individuals with asthma and a whole variety of allergies. And our group has been in practice for over 40 years.
Okay. And how does one become an allergist? Is there a lot of training involved?
Right. Well, first of all, to become an allergist, you have to first either study pediatrics after medical school or internal medicine for 3 years, and then you do subspecialty training for another 2 or 3 years in allergy.
Okay, why don't we start by talking about anatomy and physiology. Let's define what an allergy is.
Okay. Well, it depends on who you ask what an allergy is. To the general population, an allergy is any untoward, any bad reaction to something in the environment. Now, to an allergist, it's actually an immune reaction mediated by the immune system towards something you're exposed to. So a typical allergy might be the development of an immune reaction to cat dander if you have a cat in the house, causing nasal symptoms or chest symptoms.
And what parts of the sinuses are involved? Where are the sinuses?
Well, the sinuses, yeah, sure. The sinuses, brought along my little model to show you the sinuses, but this, of course, is a model of a face of an individual, and these are the sinuses that are located within the head. We have the frontal sinuses, the maxillary sinuses, the ethmoid sinuses, and way back in the middle of the head, the sphenoid sinuses. And they can be affected by allergy in that you may develop nasal congestion that then blocks the sinus drainage into the nose, and then subsequently you can actually get infected with your own bacteria and get headache and sinus pressure and discolored nasal discharge. So one of the more common triggers of chronic sinusitis could be environmental allergies.
Okay, and what are the tubes going into the ears?
Well, these would be the eustachian tubes, which drain from the posterior part of the nose right into the middle ear. And so it's not uncommon, for example, for children with environmental allergies to have recurrent ear infections or fluid in the ears because the ears cannot drain through the eustachian tubes, and they fill with liquid and then become infected. So indeed, environmental allergies can not only contribute to sinus problems, but also ear problems, particularly in little children.
Okay. And what parts of the body or what systems can be affected by allergies?
Yeah, it's a great question. Allergies are sort of unique that it can affect almost any organ system in the body. Typically, we think of the nose being involved or sinuses with nasal allergies. The lungs can be involved with asthma. The skin can be involved with hives or eczema. The gastrointestinal tract can be involved with food allergy, with diarrhea or vomiting. So almost any system in the body can be affected by an immune reaction or allergies.
Okay, so generally, is there a crossover in what type of physician is treating somebody with an allergy?
Yeah, absolutely. If you think about it, there's crossover with the lungs with a pulmonologist, potentially with the eyes with an ophthalmologist, or the nose or sinuses with an ear, nose, and throat physician, the skin with a dermatologist, the digestive tract with a gastroenterologist. So our particular specialty is sort of a global specialty that interacts with many other physicians, many other specialties.
All right, now let's talk about incidence. I've read that 1 in 5 adults are affected by allergies?
Yeah, at least 1 in 5. It's been estimated sometimes as much as 1 in 3. 20 to 33% of adults can have nasal allergies, which is the most common allergy we see. Hay fever due to pollens, or year-round allergies due to, for example, animal dander allergy or dust mite allergy. And then asthma is also very common. Up to 8 to 10% of children have asthma. So we're talking about a very frequent condition.
And I've read that it's the 5th leading chronic illness for adults and the 3rd leading chronic illness for children under the age of 18.
Yeah, absolutely. Because they're so prevalent and they're so common, and many of them are so persistent, they cause a lot of money to be spent on either medications or physician's visits, or occasionally, for example, with asthma, with hospitalization. So it's a major factor in healthcare in the United States.
Now, before we start going into the different types of allergies, let's just talk about whether some of them just go away on their own, or some of them just lifetime.
Sure. Well, it depends. It's an interesting area. There is something called the atopic, which is a fancy word for allergic march. Many times children develop eczema and food allergies in infancy or when they're a toddler, and as they get older, those allergies may disappear. For example, it's very common for milk or egg allergy to disappear by the time you reach school age, and eczema to get dramatically better, but then you subsequently develop nasal allergies or asthma. So many times, if you start with allergies as a 2-year-old, you're with the allergist indefinitely, with allergies changing over your lifetime.
Okay, so the 5 most common allergies, we'll talk about indoor, outdoor first, because that's pretty common, right?
Right.
Hay fever, is that number 1?
Well, the most common allergic condition we would see would be nasal allergies, of which hay fever is an important part, which would be outdoor allergies. And then there's also indoor allergies, which would cause year-round nasal symptoms. So the most common allergens that cause these allergies would be outdoors to trees in the spring, grass in the summer, mold throughout the spring, summer, and fall, and then ragweed in August and September. And then indoor allergies, the most common in this area would be dust mite allergy and animal dander allergy, particularly cats and dogs. So those are the most common allergens we see in the practice.
Okay, and how would these allergies be diagnosed?
Well, the first thing you do when a patient would come into my office is you get a very good history of the symptoms that bother them and the time of the year that they have symptoms, and you go over the environmental exposures, what their home environment or work environment is like. And then you take that information, you do a physical exam, and then you do allergy testing, usually by skin testing right there in the office, where you put drops of liquid on the skin, just poke through those drops, and if they're allergic, they get a little itchy welt, like a little mosquito bite reaction in the arm, and that shows that there is an allergic reaction. And there's also a way of testing through blood tests for allergy, although that particular test is a little bit more cumbersome to do. You don't get the results right away, and it's not quite as sensitive as skin testing.
But let's say if somebody goes for skin testing, how many pokes would they be exposed to?
Well, a lot of people are afraid that they're going to become a pincushion when they come to our office. But what we try to do is limit the amount of testing to the particular condition and what allergies we think are likely. So it sort of depends what they come in for. For example, if a 2-year-old comes in with asthma, I might only test for dust and animal dander and maybe a few mold tests, so just a handful of tests. On the other hand, if you have a 35-year-old who comes in with year-round and seasonal allergies, then I'm going to want to test to a whole bunch of trees, a whole bunch of molds, grass, weeds, including ragweed, animal dander, dust mite. So you have to sort of base your testing on the historical features. So it could be anywhere from a handful to several dozen, depending on the situation.
So how do you know that you have dust mites? I mean, what is a dust mite?
Well, a dust mite is a microscopic insect that's invisible to the eye. And the nice thing about being an allergist is everyone has dust mites. They're ubiquitous. They're everywhere. So it makes our business very good. For example, take this room where we have carpet. There's dust mites right there in the carpet or the upholstered furniture. So anything with texture gathers dust mite. And dust mites are indoors. They're not outdoors. Dust mites don't survive freezing temperatures, and they don't thrive in very hot conditions. So one of the reasons we think that there's more allergies in Western society in the United States over the past 30, 40 years is that everything we've done in our homes to make us more comfortable make the dust mites more comfortable. Humidity that's been increased in the homes, the heat that's in the 60s to low 70s is perfect for dust mite growth. So we all have dust mites. They're everywhere.
What do they feed on?
Well, the Latin name for dust mites is dermatophagoides, which means skin eater. So they eat skin, not that's on us, fortunately, but they eat skin that we shed. You know, we're always replacing old skin with new. And these little particles of skin end up in air currents, and then they end up precipitating on the floor or in the bedding. And so the dust mites live where the skin scales are, and dust mites eat the skin scales.
Okay, and how can you get rid of dust mites? What should you do?
Well, the single most important thing to do is have no carpeting in your bedroom if you have dust mite allergy. So dust mites do not flourish if you have wood floors, tile, or linoleum. So even thin commercial carpet is full of dust mites. So the single most important thing is no carpet. The next important thing is to wash your bed sheets in hot water.
Hot water.
Because only hot water kills dust mites. If you put them through a lukewarm wash, the dust mites survive. So you want very hot water, 130 degrees Fahrenheit or higher. And you want to put impermeable barriers around your mattress and pillow. It also makes it less hospitable for dust mites. So hot water wash, impermeable barriers, and most importantly, no carpet, particularly in the bedroom.
Okay. Now, what about treating these indoor-outdoor allergies?
Allergies. Well, after you make the diagnosis that someone has an allergy, then you have three ways you can treat it. One is to avoid your exposures, which is not so easy. You know, as we talked about, you live in an apartment, you're not going to make your apartment owner very happy if you rip up the carpet. So you can't do that much. So you want to do as much as you can in the indoor environment. Potentially, if you have cat allergy, it would be advisable not to have the cat at home, but we know how difficult that is to deal with, or remove carpeting. So you want to remove the thing that you're allergic to. If you have pollen allergy, air conditioning can be very helpful. Air conditioning with the windows closed can remove 95% of pollens from the indoor environment. So the first thing is environmental control. Second thing would be medications. If we're talking about nasal allergies, it would be antihistamines, prescription nose sprays, particularly eye drops if you have eye allergies due to environmental allergy. And then the third thing would be allergy desensitization injections, essentially allergy shots, which are a way of making you much less allergic to things that bother you. And the allergy shots work very well for pollen allergy, trees, grass, ragweed, for certain molds, for cat dander. So they can be useful in desensitizing you, making you less allergic as well.
So how often do you need the shots? I'm assuming with the pollen, is it only during the season where there is pollen?
Yeah, it's a good question. Actually, allergy shots are year-round. Now, years ago, they were done pre-seasonally or co-seasonally just for a few months, and they can work that way, but they work much better if you get them on a year-round basis. And that makes it, of course, difficult for the individual with the allergies to get in on a regular basis to get shots. But usually allergy shots start weekly for a number of months, then they go to every other week for a number of months, and then eventually they're every month for a couple of years. So it's usually a 3, 4, sometimes 5-year process in desensitization. And we like to tell patients, for example, if they have grass allergy, if we're able to get to a high enough target dose, they could likely be 60 to 80% improved. Now, unfortunately, they're not totally desensitized. It's unusual to be 100% improved, but we can certainly improve their lifestyle where they're dramatically better, take less medicine, and can tolerate the exposures a lot better.
I'm wondering if there's less seasonal allergy sufferers in big cities that don't have grass or pollen or anything like that.
Well, to a slight degree that's true, but one important thing to recognize is pollen travels for miles and miles and miles. You could live in Manhattan and have much less grass pollen exposure, but it's going to waft over from Connecticut and New Jersey. It can go miles and miles, so there's no escape from these allergies.
Okay, let's talk about Fluffy the cat.
Yes.
Cat allergies, animal allergies.
Right.
Do those just happen any time of people's lives? It could just come up?
Well, year-round allergies to animal dander or dust mite can occur starting in when you're a toddler. It's not uncommon to see a 1 or 2-year-old who's developed dust mite or animal dander allergy. And they can continue for decades afterwards. And as we mentioned a little earlier, the most important indoor allergies are animal dander allergy, particularly cats, and dust mite allergy.
Does having an animal cause more dust mites?
Interesting question. I'm not sure the answer to that, but I suspect it does to some degree because dust mites, again, eat skin scales, and if you have flaky dander from a cat or a dog, it stands to reason you're probably going to have more dust mites. But I'm not sure that that's been scientifically shown in any great degree.
Okay, so there's more people that are allergic to cats than people that are allergic to any other animals, right?
Yes, and I would say certainly compared to dogs, there's a lot more very cat allergic patients than dog allergic patients. There are other animals that are very allergy provoking as well, but they're just not as commonly encountered. For example, rabbits, guinea pigs are very highly allergy provoking, but there's just a lot more dogs and cats out there than rabbits and guinea pigs living in indoor environments.
Now, does the gender of the cat make any difference on how allergic somebody would be to it?
Yeah, interesting question. We don't know for sure. There have been some reports in the past decade that male cats are more allergy provoking than females, and that black cats are more allergy provoking than white cats. But that information has been conflicting in studies, and I'm not quite sure how that bears out in the final review of that material. So it's tantalizing, but I think I'm not ready to tell people to go get a white female cat as opposed to a black male cat.
Okay, so there's another thing about the cats. Hairless cats,
Yep.
Does that make any difference at all?
You know, we don't know for sure, but I think probably not a huge difference because it's really not the hair that's the problem. It's the saliva and the sweat gland discharge, the sebaceous gland discharge that causes the problem. So you do hear a lot of people talking about short hair, long hair cats. I'm not sure it makes much difference. But I will tell you might find this interesting. There's at least one company in the United States that's producing lower allergenic cats that have been bred to have less of the cat allergen. And those actually have been shown to cause less problems. The only problem is they're incredibly expensive. You have to be prepared to spend $10,000 to $40,000 on your pet cat.
Oh my gosh, that's just crazy. Okay. Now, diagnosis, how would you diagnose an animal allergy?
Well, just like we would for dust mite or pollen, we would, there are allergy extracts we purchase from pharmaceutical companies, and you put a drop of this extract on the skin, poke through the drop, and if you get a little itchy welt, a little mosquito bite reaction, then you've shown the presence of allergic antibody, which is called IgE, immunoglobulin E. And that you take along with their history of having symptoms, and you put two and two together, and you have corroborated that they're truly allergic.
So how many different tests are there for cats, and how many different tests are there for dogs?
Well, good question. We have one test for both cats and one test for dogs. There are two main allergens produced by cats called FeLD1 for feline domesticus 1 and FeLD2. And all cats have those, and they're in our allergy extract that we test for. There's also one skin test available to dogs, but dog allergy is much trickier, Peggy, because unlike cats where there's two important allergens, in dogs there's dozens of less important allergens. And we're not in science to the point where we can do a panel of 20 different dog skin tests to tell you which breed you'd be less sensitive to. Although that would be an awfully nice thing if we had that available.
Yeah, and that's my question is once you know what you're allergic to, can you somehow, go to the animal shelter and say, I know I'm not allergic to this dog, I'm going to get it.
Good question, but very inexact science. With cats, if you're allergic to one cat, you unfortunately are going to still be allergic to other cats. It may vary slightly, but not dramatically. With dogs, there are breed-to-breed differences, but the only way of knowing, honestly, is to spend some time with that breed of dog and see what happens. Visit it, see what symptoms you get, go back and visit it again. But unfortunately, we're not to the point where we can say, you're less allergic to a poodle, go get a poodle, or less allergic to a beagle. If we had that, I think that would be a great aid to allergy diagnosis and treatment, but we're not quite there.
Okay, so how are the animal allergies treated?
Well, first of all, avoidance. But we know how difficult that is because you're very attached to your pet, and if you're allergic, there's many people only go so far. But if not that, then the medications many times can successfully treat it. And thirdly, allergy injections, which can work very well, particularly to cat allergy, but less well to dog allergy.
Okay. All right, next we have eye and nasal allergies.
Yep.
Can you define those?
Well, we've talked a little bit about them already, but nasal allergies would be what you typically think of as hay fever: runny nose, stuffy nose, itchy nose, sneezing, along with itchy, watery eyes. And those can occur seasonally in a pollen season, or they can occur year-round due to animal dander or dust mite exposure. And those same allergens can occasionally aggravate asthma or produce asthma. So it's not uncommon. We'll see someone highly cat allergic that gets not only nasal and eye symptoms, but gets itchy skin and gets wheezing. And of course, that's a more dangerous problem.
Okay, and those generally have the same treatments?
Same sort of
as the other
treatments.
ones?
Again, avoid what bothers you, medications, and potentially allergy injections.
Okay. Now, some people don't realize that asthma is a type of allergy.
Yep.
Can you go into that?
Well, yes. Asthma is considered an allergic condition because many asthma sufferers do have allergies that aggravate their asthma, but not everyone. It's sort of tricky. If you're a young adult or a child, there's probably a 2/3 to 3/4 chance that if you have asthma, you have allergies contributing to it. If you develop asthma in your 60s or 70s, it's much less likely to be allergic, much less frequent. But asthma is generally considered an allergic condition because many times allergies plays a role in asthma. And as a matter of fact, the National Institute of Health suggests that if you have a child or an adult who has chronic asthma requiring a daily preventive medicine, they should have some sort of allergy testing to see if allergies play a role in their asthma.
So what are the symptoms of asthma? What goes on in the body?
Right. Well, asthma would be chest tightness or shortness of breath or wheezing or cough. And a lot of times people forget that cough can be an asthma manifestation. So someone who coughs with cold air exposure, coughs with exertion, has a cough that lasts for a few weeks following a cold, very well may have asthma. So any sort of chest symptoms, cough, wheezing, chest tightness, shortness of breath, those are typical asthma symptoms.
Does it mean they have less air in their lungs?
Well, what it means is they have inflammation of their airways and narrowing of their airways, so it's hard to exchange air as well. And also they have mucus production that makes them cough or clear their throat. So it's a combination of mucus production, inflammation or swelling, along with bronchospasm, the smooth muscle around the airways narrow, which give you that wheezing sound. And the final result, as you just pointed out, you don't get air in and out of your chest as much. And if it's severe, you could have a dangerous, potentially life-threatening reaction to it.
Now, has the incidence of asthma gone up in the last few years?
Unfortunately, it's gone up dramatically. Childhood asthma, for example, doubled from 1980 to 2000. When I started my training in the early 80s, it was thought that maybe 3 to 5% of children have asthma. Now the numbers are 8 to 10%. So asthma has increased, and environmental allergies have increased in the United States in the past couple decades. And a lot of people have called this the asthma epidemic, that it's just become extremely commonplace.
So how does a physician diagnose asthma?
Well, you start just like allergies with a good history. What are your symptoms? What happens when you exercise? Do you get more short of breath than you think you should? Do you cough? Do you wheeze? Do colds linger in your chest? So you start with the history, then you move to potentially doing a lung function test, where you test the expansion of the lungs and how rapidly you get air out of your chest when you blow out hard. And after you do that, then you come up with a treatment plan in terms of how to avoid things you're allergic to, what medicines might be useful, and also, again, whether allergy injections may be helpful.
Does air quality affect asthma symptoms?
It absolutely can. Not only do allergies affect asthma, but air quality, sulfur dioxide, particulate matter are both horrible for asthma. Ozone is bad. And you may recall this last Summer Olympics, there was a lot of concern going to China with poor air quality, whether that would affect not only the athletes, but the spectators. And because of that, the Chinese took a lot of steps to at least temporarily improve their air quality. at their Olympic venues for that reason.
Wow.
They shut down factories, they decreased automobile use to try to make it cleaner air, because poor air quality absolutely aggravates asthma. Pollution is very bad for asthma.
Okay, so how is asthma treated?
Well, asthma is treated after you look at allergic triggers and decide what to avoid, treated with a variety of medicines. The most common medicine to treat asthma would be an inhaler, and I have one with me today. Whoops. This would be an albuterol inhaler, and this you would take 2 puffs of this if you needed to every 2 to 4 hours to relieve asthma symptoms. And if you need such an inhaler more than a few times a week, then our next move is to consider a preventive medicine, because this is just a rescue medicine. And preventive medicines generally include steroids, inhaled steroids. And despite the word steroid, if you use them carefully, they can be very safe and very effective. And I brought one of those along as well. This would be an Advair discus, which contains a long-acting bronchodilator to open up the lungs, and an inhaled steroid to decrease inflammation. And this would be a common drug to use for more moderate or more severe asthma.
So are athletes allowed to use those, or are those banned?
Yes, you can participate in the Olympics with these devices as long as you have a physician's report to specify that you have asthma and need to use them. So these are not banned substances. And it can be a tricky matter because, as you may know, and many of the listeners, pseudoephedrine is a banned substance. So if you were to take over-the-counter Sudafed and then run in the 100-yard or 100-meter dash in the Olympics, they would do a blood test and you would lose your gold medal. But these devices are fine to use.
Okay, next is skin allergies.
Yeah.
Can you define those?
Well, skin is another area that's commonly affected by allergies. I think the most common way to describe this is the conditions that we would see. Eczema, which is real dry, itchy, flaky skin, is generally considered an allergic condition. And hives can be an allergic condition, large, itchy welts. So those would be sort of the most common allergic manifestations. The other thing we may see is you may see the skin involved as part of a more serious allergic reaction. For example, peanut allergy. If you had an individual with peanut allergy and they ingested peanut by mistake, they may get a rash as well as nasal and chest symptoms and more severe manifestations. So those are the sort of things we would see from an allergic manifestation.
And how would you treat hives?
Well, hives, it's sort of a common theme with allergy. If you try to identify the cause of the hives, if they're allergically triggered, avoid what that trigger is. For example, if you knew it was a medication allergy, stop that medicine. If you knew it was a food allergy, avoid that food. So avoidance is number one. Next would be medicines. Typically you start with antihistamines, Benadryl, or because that can make you sleepy, you might move to a Claritin, an over-the-counter Claritin. And then if that doesn't work, there's a whole hierarchy, a whole list of other medicines you might add. Unfortunately, generally there are no allergy shots for hives. There's no desensitization. So there you got to stick with medicines and avoidance.
And let me advocate for the viewers that they shouldn't self-diagnose in this case, right? They should be seeking medical attention.
Well, that's particularly true if they think they might have a food or a medicine allergy, because those can be life-threatening. And you really would like to know what you're allergic to avoid that. So not only should they not self-diagnose because you really want to know what you're allergic to, but also the treatment can have issues. For example, if they treat with over-the-counter Benadryl, that can be very sedating and affect their job performance or their driving ability. So they want to choose some alternate medicines to use.
Now, you had said something to me earlier about Benadryl.
Yeah.
About how much it actually affects your body.
Right.
Can you just repeat that?
Well, yeah. I mean, we all know that Benadryl can make you sleepy if you take enough of it. But there was a well-publicized study, maybe a little over a decade ago, where they took individuals and either gave them Benadryl 50 milligrams, which is a normal adult dose, or had them drink alcohol to get a blood level of 0.10, which at that time was the legal limit to being drunk when you drive. And they actually showed that Benadryl affected driving ability in this study as much so or more than alcohol. So the scary thing about Benadryl is if you have enough, you can feel a little woozy, but it can also affect your cognitive abilities, your ability to function at work or in school, and if you drive, it can be even dangerous. And there's some states which have laws on their books that you can actually receive a traffic ticket for driving under the influence of a sedating antihistamine. Although I'm not sure that that's actually put into effect in those states, but it's on the books.
Wow. Okay, next is food and drug allergies.
Yep.
What about those?
Well, food allergies have also exploded in the United States in the past few decades. When I first started practice 20 years ago, I would see anecdotally maybe 1 or 2 kids with peanut allergy a month, and now I probably see 3 or 4 per week. And there have been studies that show that peanut allergy has doubled in the last 20 years as well. So food allergies are definitely on the rise in the United States. Drug allergies, I'm not sure they're on the rise, but they're also common. The most common drugs that cause allergic reactions would be antibiotics, like penicillin or sulfa antibiotics. And the second most common that can cause allergic type reactions are actually medicines like aspirin and Motrin. But basically any drug can cause an allergic reaction.
Okay, and how do you diagnose food and drug allergies?
Food allergy is not hard to diagnose. You can do skin testing or sometimes blood testing for food allergy that's quite accurate. Drug allergy is much more difficult because unfortunately the technology lags here. We do not have good skin tests or good blood tests currently for drug allergy. So there you're stuck with doing good detective work, spending time with the patient, looking at the probability that a certain drug may cause a reaction, looking at the nature of the reaction, putting it together temporally and making the diagnosis. But it's much more difficult to diagnose specific drug allergy than it is food allergies.
So let's say you have a severe peanut allergy. What kind of precautions do you need to take on a daily basis?
Well, for first of all, you've got the only treatment currently for food allergy is total avoidance. So if you have peanut allergy, you have to avoid obviously foods with peanuts, foods that are listed that may contain peanuts on the label, or foods that are processed in a facility that produces peanut products. So you have to look carefully at the labels. And then the real risky thing is going to restaurants where you're never quite sure what can be cross-contaminated. So you have to really be proactive and talk to the waitress or waiter or the staff there to identify that you or your child has a peanut allergy and make sure that this food is going to be safe to ingest. And that can be a real nightmare, as you can imagine. The second thing is always have an emergency medicine available. And I brought in one of those, which is this of course is a placebo, but this is an EpiPen device. And this contains adrenaline or epinephrine, which is the main antidote to a severe allergic reaction.
Okay.
And you must always have this present if you have a severe allergy. And it's very simple to use this. All you have to do is remove the top of this magic marker-like device, and you press it into the meaty part of the thigh, and it discharges epinephrine to help reverse the allergic reaction, and then you go right into an emergency room afterwards.
Now, what's the easiest way of carrying that thing around? I mean, do they have ones that are on ropes, or what do people do?
This is a problem because, as you notice, it's a pretty large device, and so men are loath to carry this because who wants to put in your pocket and carry this around? Women are much better at taking care of their health in general and in carrying this device around. The other thing is children keep this at the school nurse's office during the school day. But there's a desperate need for a smaller epinephrine device than this. And there's some research going on now to look at devices a third to half the size. And I think that would be very useful. Personally, I'd like to see for men a device that's thinner that could fit in a wallet and they'd carry it around, because it's only as good as the availability of having it.
Now, what do you think could possibly explain the amazing incidence rise in the last few years?
Yeah.
What could it be?
Well, it's a great question, and no one knows the answer, and there's probably a Nobel Prize waiting for someone who comes up with that answer. But there's a number of theories as to why allergies have increased. The one you and your listeners may have heard of is called the hygiene theory. And its simplest explanation of this theory is that we've become a little too clean in Western society and used antibiotics too often in young children, and they're exposed to certain types of bacteria less frequently. And because of that, the immune system, instead of fighting infection, moves the other way and produces an immune response that's pro-allergic, that produces allergies. So what we've done to knock out infections early in childhood may actually skew the immune system to produce allergies. Now that's one common theory. Another theory is indoor allergens have increased. As I alluded to earlier, we have more dust mites in our house because we have more carpeted floors than we did 40 or 50 years ago, higher humidity, more indoor pets and tighter homes. There may be more allergen exposure. And there's another theory that diesel exhaust in the air may also increase allergies because the diesel exhaust actually attaches to allergens in the atmosphere and makes them more allergy provoking.
Interesting.
And a final thing I might say is the food allergies. Some people think that they've increased because of changes in the eating habits of children. There's a study going on now that what we're doing may be currently completely wrong. We've told families that are allergic to avoid peanut until the child is 3 or 4 years of age, so they're less likely to become peanut allergic. And we're now finding that may be absolutely wrong. It may be important to expose them early on, desensitize them, and they're less likely to become allergic.
It's very interesting.
Yeah.
All right, and lastly, let's do insect allergies.
Right.
What about those?
Insect allergies is an area that I'm particularly interested in. When I did my fellowship in the early 80s, I did it with Dr. Reisman in Buffalo, whose expertise was insect sting allergy. And they cause in the United States 50 to 100 fatalities a year from yellow jackets or wasps or hornets or honeybee stings. And we can also diagnose those through skin testing or blood testing. And we have treatment for that that's almost 100% effective. Allergy desensitization injections can almost without exception prevent you from more severe reactions in the future. So if an adult comes into my office and they've just had a yellow jacket sting that landed them in the emergency room with hives or wheezing, we can test them, find out what they're allergic to, put them on a series of shots and reduce their risk dramatically back to the same as their spouse or their friend, where the risk is only 1 or 2% for future stings.
Can a bee sting result in anaphylaxis?
Absolutely. Commonly can result in anything from hives all the way to death. And as I mentioned to earlier, there are every year in the United States 50 to 100 deaths due to bee sting allergy. And it is completely preventable if you know that someone's allergic through desensitization injections. And of course, you must always have an EpiPen available as well.
Okay. Lastly, if we just want to review how to allergy-proof a house.
Well, you want to, first of all, find out what you're truly allergic to, because allergy-proofing a house without really being sure that you're allergic many times doesn't get done, because who's going to rip up their carpet in their bedroom unless they're really certain that they're dust mite allergic? But what you want to do, if you're dust mite allergic, is have no carpeting, particularly in the bedroom, wash the bed sheets in hot water, have zipped up allergy encasings. If you have pet allergy, you must keep the cat away from the bedroom or the dog.
Okay.
You may consider an air cleaner in your bedroom, a HEPA or electrostatic cleaner, which can be useful. If you're pollen allergic, you want to make sure the windows are closed during pollen season, and you have either an air cleaner in your bedroom or air conditioner in there. So there certainly are environmental things you can do, but the bedroom is the place to really put your time and energy in, because you may not think about it. An adult is in there usually 7 or 8 hours a day, and a child maybe 12 hours. So that is the key environment to pay attention to. Okay.
Lastly, let's just review further contact information. Your practice has a website?
We do. It's called certifiedallergy.com, and we have links to a lot of national organizations and a lot of good information there. And we're called Certified Allergy and Asthma Consultants, and we're located in offices throughout the Capital District.
Okay, and I have another website, acaai.org.
Right. That's the American College of Allergy, Asthma, and Immunology. Okay. And that would be one of our national parent organizations. That the college and the Academy of Allergy have really reputable information on their sites. And you can also find the link to that through our office website at certifiedallergy.com.
Okay, and then just the practice telephone number.
Well, our main number in Albany is 434-1446.
Okay.
And as I said, we have offices elsewhere in the Capital District.
Okay, Dr. Osur, thank you so much. It's been very interesting.
Oh, okay, thank you, Peggy. And I enjoyed this conversation, and I'd love to talk to you again about other aspects of allergy.
Thank you. Thanks for watching. We hope to see you next time on Focus on Health.